7:37 in Trinidad and Tobago. A bit of regional coverage now as we head to Guyana, where a High Court judge refused to grant an injunction that was aimed at blocking the government of Guyana from implementing several measures aimed at curbing the spread of the coronavirus in the country, and this is according to media reports. The Guyana Teachers Union, the Guyana Public Service Union, and the Guyana Trade Union Congress had sought the injunction against the government policies, which, among other measures, would prevent unvaccinated persons from accessing public buildings and seeking government services unless they produce a negative PCR test. Well, Attorney General and Minister of Legal Affairs Anil Nandlall had argued that according to the State Liability and Proceedings Act, an injunction cannot be granted against the state. The substantive matter is yet to be heard and no date has been fixed as yet, although Attorney Darren Wade, one of the two lawyers representing the unions, indicated he would like the matter to be heard urgently. Well, we're joined now by Minister Nandlall, who is originally from Monrepo, not Monrepo near San Fernando in Trinidad, but Monrepo, East Coast Demerara in Guyana. He joins us now. Attorney General, thank you so much for joining us this morning.
Thank you for inviting me, and good morning to all your viewers and listeners across Trinidad and the Caribbean and elsewhere.
Well, as you know, Attorney General, this is a very contentious issue in many parts of the Caribbean and, of course, including Guyana. And again, because that injunction was not granted, where do you see this process as far as the Guyana government insisting on this policy of being vaccinated to enter the workplace or indeed public spaces?
The Guyana government will continue to press on a position that will ensure that the vaccination is taken as far as possible. And short of making it mandatory at this stage, whatever it is that the government can lawfully do to ensure that the population receives or takes the vaccine, the government will pursue that to every end. Fazeer, we cannot, at this stage, I can't imagine that we are still having a conversation about taking of the vaccines when one sees the devastation that is taking place, even now in this latest incarnation with how the vaccinated are now dying. I can't believe that we are still having a conversation about the viability of the vaccines. We in the Caribbean, Guyana, we have done nothing different from what the rest of the Caribbean has done. The Caribbean has done nothing different from what the majority of the world has done. And what we are doing is in keeping with international protocols promulgated and accepted and recommended by the World Health Organization and PAHO. I keep making the point over and over that yes, you have fundamental rights and freedoms in the Caribbean, like everyone else in the world, but they are subject to guidelines that must emanate if there is an infectious disease or there is a public pandemic. The Constitution itself, which confers these rights and freedoms, tell you that in very clear language. They are an exception. I also make the point that vaccines are not vaccines in the region where people must take them. It's not a new phenomenon. We have had vaccines in the region since in the early 70s in Guyana. I can show you a mark where I have had vaccine as a child. Every Guyanese in my age group has had to take that vaccine before we were acceptable or accepted in a public school, in the public school system of the country. So this thing is nothing new to Guyana. I saw an opinion written by Belantwine, professor and the former president of the Caribbean Court of Justice, to the Eastern Caribbean government. And they made all those points, the very points that I am making. So I think that we have gone past the stage now of whether the vaccines are illegal and whether the measures which we are imposing are illegal. I think we have gone past the stage. Our courts have looked at it and refused an injunction on the ground that a case has not been made out to injunct the government or prohibit the government from implementing or continuing to implement the measures that you so well articulated in your introductory remarks. And those measures are consistent with what you are doing in Trinidad and the rest of the Caribbean is doing. So I am happy that at least the judiciary is now brought in the equation, and the judiciary, and I'm happy that Guyana has been one of the very first countries in which the judiciary has made a pronouncement, albeit at an interlocutory stage of the case. If I may be so bold to predict, I can't imagine that the end result or the substantive case will be determined differently. I believe that it will be the same result.
And Nandlall, just on that point, when is it to be heard? Because I referenced the attorney Darren Wade suggesting that this is a matter of great urgency. What sort of timeline are we talking about here?
Unfortunately, the case has not been assigned to a judge. The judge who heard the application for the injunction is not the judge who has been assigned to hear the substantive matter. So unfortunately, we are waiting for that. But I have no doubt that we will get an early date because of the importance and I suppose the urgency of the matter as well.
And A.G. Nandlall, I take your point about the early vaccinations that we all had as children in the late 60s, early 70s to get into the public school system because we're all part of the British Commonwealth at that time. But how do you respond to those who will say that this is a new situation? Not enough time has passed to allow for everybody to feel 100% or 95% comfortable with the vaccination process for COVID-19, apart from any considerations of whether someone should be allowed to choose whether to take a vaccine. What validity do you give to that argument?
Fazeer, one has to act in accordance with the exigencies of the situation at hand. Was time available? Time was not available. I suppose the experts in the world had to do what they had to do in the circumstances given. And I believe that we should be grateful that they have come up with a vaccine that has so far proven to be effective. It has not proven to be disastrous. In fact, if we are going to judge it, it has delivered. It has satisfied the expectations. So in those circumstances, I think that we should welcome that which we have. We didn't have the time, that is true, but the time was simply not available. And the evidence seemed to suggest that had we not taken the vaccine, the genocide would have been much more rampant. That is the science, that seemed to be the data. Had we not taken the vaccines, what would have happened? The disaster would have been much, much more pronounced.
And as far as Guyana's status, as far as being vaccinated, I'm checking the latest data available, and you can correct me if I'm wrong. It states that fully vaccinated in Guyana is less than 25% of the population. Would that be correct from the information that you have?
No, we are measuring it with both, we have statistics that deal with the first dose, then second dose adults, and then children. I believe with the first dose adults, we are somewhere in the vicinity of 65 closing into 70. In terms of the second dose, we may be somewhere in the 40s. In terms of children, I'm not sure where we are.
And as far as the entire process of the vaccination, do you see this entire situation leading towards mandatory vaccination being established in this situation?
I don't want to be preemptive, and I believe that the medical people who are assessing the situation on an hour-to-hour basis should make that as an expert call. But if it is that is what it will take to save lives, well then, so be it. The law will have to bend and bow to the glory of life itself.
And as far as the situation as it prevails in Guyana, because we're aware for several weeks now about the level of discontent within the trade union fraternity in some elements, with certain elements of the workforce being kept out of public spaces and in some cases even private spaces. What is your own sense, A.G. Nandlall, as to the public perspective on this ongoing discussion?
I think that we are gradually getting compliance, because the population is recognizing slowly that we are moving in the right direction, and we are now getting compliance. I see the teachers union recently wants to talk to the Minister of Education. I suppose we will see a similar gesture from the other unions. The private sector is now partnering with the government in executing this policy. Recall, we have a definition of public buildings that includes privately owned building to which the public has access. It means, therefore, that malls, cinemas, stores, and all the other private places where the public would normally have access fall under the guidelines, and therefore the private sector is part and parcel of the enforcement mechanism. And I am pleased to report, by and large, from my observations, though not scientific or clinical, I get the impression that there is a smooth acceptance of the measures, and the measures are being obeyed and enforced.
And just so I could understand it, based on your the understanding as it prevails in Guyana, if I wanted to say, for example, go and watch cricket at Providence, would I have to be vaccinated to be allowed in?
Yes, you have to be, because that's a public building, that's a public place. We have a definition to which, and the definition determines whether you get a vaccination card or not. And it's in the protocols, it's in the Gazette, and has been widely published. And that's the latest incarnation of our guidelines.
And Attorney General, as far as the issue of PCR testing, that is a major bone of contention with the trade union movement in Trinidad and Tobago as well, where those who are not vaccinated are required every 2 weeks to produce a negative PCR test, which is quite costly in the Trinidad and Tobago situation. Is there a similar type of scenario in Guyana?
There is, it's similar. The time frame may not be identical to Trinidad, but it is the similar principle is captured. And that is the principle, I believe, that is captured throughout the Caribbean.
And what do you say, Attorney General, about for the workforce who may say they may not be able to afford a PCR test? Because I don't know what the cost is in Guyana, but I know, for example, in Trinidad, it can be anywhere upwards of 1,000 Trinidad and Tobago dollars for that PCR test every fortnight.
It is, the cost is about the same throughout the Caribbean. So it would not be much different in the territories of the Caribbean, the PCR test cost. But Fazeer, the position is that take the vaccine.
And if someone says, you know, it's my human right to determine what I will allow in my body or choose to not allow in my body,
well, then you comply. Well, then if you choose to exercise your freedom that way, then you have to comply with the conditionalities that attach to that freedom. Now, if you want to travel, Fazeer, you have all the constitutions of the Caribbean tell you have a freedom to travel. Now, travel across borders. If you decide to exercise that freedom, you have to get a passport. You have to buy a ticket. You have to get a departure pass. You have to go to the airport at a certain time. You have to subject yourself to certain security measures. That is the cost of freedom, if you want to exercise that particular freedom.
And a final thought, Attorney General Nandlall, as far as you sound very confident that the courts will stand by the government's position in this regard. But are you entertaining the prospect that they won't? That it could be prolonged?
You are right. I am confident that the court will weigh in favor of the public good. This is not about the government. This is where you have to make a choice. Is it in the public interest that the vaccines should be taken, or is it against the public interest that the vaccine should be taken? That is the decision. It's not about the individual. I am all for individual freedoms. I will support and I will champion the cause of individual freedom wherever it arises. But here you have individual freedom weighing against the public good, the public health, the individual freedoms of the collective. And if the collective say that we want to go in this direction, and the medical evidence show that this direction is safer than the individual, that which the individual is choosing, then the law says, the great institution called the law says, that the scale of justice must weigh in favor of the public good. And that is the position that I'm advocating, because that is philosophically how the law is intended to be applied.
Attorney General Nandlall, who's also, of course, Minister of Legal Affairs, we want to thank you very much for taking the time to offer that perspective to us this morning. Thank you very much, sir.
Thank you very much, sir.
You're more than welcome. Attorney General for Guyana, Anil Nandlall, who's also the Minister of Legal Affairs, just elaborating on the latest developments in Guyana when it comes to this whole issue of vaccination and having vaccines and being vaccinated to be allowed into public spaces and government buildings, or indeed public buildings, which are private buildings, which are defined as having public access, and so much that is tied into that.